Well, good morning, everyone, and we're trying to start right on time. Welcome to the UCLA Health Core Kidney Conference. My name is Philip Palmer. I work at ABC7 in Los Angeles. We are very pleased that you're joining us today. One of these days, we're actually going to be back in person and be able to see each other, and we're ever closer to that day every day that passes. Now, this is an amazing turnout. You're joining us from Los Angeles, of course, all over California, the United States, the world. And it's all thanks to the power of Zoom, which all of us are getting more and more and more familiar with as the year progresses. This morning, we present a fast-paced hour. That's one of the reasons we're starting so quickly to being right on time. We have a lot of information. If you were here a little bit early, you saw a lot of the information that was presented to you in that video. We're going to have the latest on all things kidney health. We're going to have an update on where we are with COVID in relation to disease, but also LGBTQ health, as well as equity, diversity, and inclusion. We have amazing UCLA health speakers with us this morning. I'm going to introduce them to you very quickly. Dr. Anjay Rastogi, Dr. Daniel Ucla, Dr. Gabriel Danovich, Dr. Keith Norris, and Dr. Amy Weimer. All are renowned experts in their field, and we are honored to have them with us today. They will be introduced more fully when they speak. They'll have brief talks, and then we're going to be followed with a panel discussion. They're going to answer some follow-up questions about their presentations, some other topics you might find interesting. But this is the interactive part. You can ask a question by using the Q&A button right there at the bottom of your screen. All of you know that with Zoom by now. In that Q&A window under each of the questions, you're also going to see a little thumbs up icon. So what you can do is you can vote to a question that you might like. A number of them, a number will appear to next to each thumbnail. So it's kind of a voting, and then that's going to represent how many times that question has been upvoted. The questions with the largest number of upvotes were going to appear at the top of the Q&A screen, and we're going to try to answer as many of those as we can, but we're also going to try to make sure our medical experts answer those questions for you. Whether we talk about them in the Zoom call or not, we're going to try to get those questions answered. We have a very full agenda. We're going to get started right away. So at this time, it is my pleasure to introduce the president of UCLA Health, Jonice Spisso.
Welcome, everyone. What a pleasure it is to join you. I'm Jonice Spisso, president of UCLA Health and CEO of the UCLA Hospital System. And it's my honor to welcome you to the 7th annual UCLA Health Core Kidney Conference. This event used to be at the beach, of course, and was known as the UCLA Health Kidney Fair. We may go back to that next year, but for now, we are all together virtually, which is an advantage because it has brought us closer to our UCLA campus in Westwood, but also across California, the United States, and around the world. The theme of this year's conference is educating, empowering, and inspiring hope. In a year that's tested all of us in ways that we never could have imagined, we hope today's conference will leave you feeling inspired and positive about the incredible work being done to address both the pandemic and kidney disease. And we also want you to feel hopeful because we know the future is bright as science triumphs in the battle against the COVID-19 virus and kidney disease. I'd like to recognize the extraordinary contributions of all of our frontline healthcare workers here and around the world in confronting the public health emergency. I'm very proud of the role UCLA Health has played in the delivery of all aspects of kidney care, our clinical care, outreach, research, and education. We've been recognized by US News and World Report as #3 in the country and #1 in the West in delivering the very highest standards of kidney care. We are so proud of Dr. Anjay Rastogi's leadership on the clinical side. He's built a world-class team of physicians, researchers, and educators who are positively impacting the lives of patients here in Southern California and around the world. Today, you'll hear from some of UCLA Health's leading experts in the fields of nephrology and kidney transplantation, and you will also hear about our global leadership in health equity, diversity, and inclusion. March is Kidney Awareness Month, and we thank you for joining us for a little celebration, but also education. Enjoy the conference, everyone.
And thank you to Jonice for that video. And it is kind of true. We're able to reach so many people across the world due to the power of Zoom, but one of these days we're going to be back together at the beach. The UCLA Health Core Kidney Program was created a decade ago to take patient care to the next level. Designed with a holistic approach, the program has distinguished itself as a trusted resource for kidney patients and their families.
Kidney disease is quite prevalent. 1 in 3 patients, adult US population, is at risk. 1 in 7 actually have some form of kidney disease.
We started it because there was an unmet need for patients to learn. We noticed that we were repeating ourselves and teaching patients the same thing. They were asking the same questions.
One of the unmet needs I found out early on in my medical career was the care that the patients get is fragmented. That was number 1. Number 2, the patients are not involved in their own care. They're not part of the care team. And those 2 things were always in the back of my mind. And that was the start of the core kidney, the principles, way back about 10 years ago.
You know, I think just patients need that extra, that extra love or that extra care, or just know that you're there and that, all is well and everything's going to be okay.
So one of our key missions of the Core Kidney Program is to make patients and their loved one their best advocates.
That's what it's for. We stand by our core values, the values of clinical excellence, the outreach, the research and the education, and just being there for our patients is our number 1 goal. You have a strong team behind you, and we're here to help support you and care for you and be your health team.
Our team is very, very close. We work very well together. Lots of projects that everybody has a role in the Core Kidney Health Program.
When patients and their family and loved ones are more involved in the care, we get better outcomes. And I always tell my patients that they are part of the care team. And I do, and when I say I talk about with my team, the Core Kidney team, does everything that we can to educate them and provide them resources.
And so we decided to put together some educational programs that started off as one-on-one, and then we started to have them in a conference room. It became standing room only. Then we decided to have a kidney fair where we can have more space, where we were able to have a public event and have many more than just the 200 people at the auditorium.
We were able to expand the program with several clinical programs, including our genetic kidney disease, including polycystic kidney disease, Fabry, Alport. Of course, we had very good support from our own patients, their families, their friends and network, which we call Circle of Core.
So my patients who were a part of the core program came to me and said, we want to form a program outside UCLA Health, but supporting the program. And that's the genesis of Circle of Core. And our purpose was to increase kidney disease awareness. And that was the start of the Green Ribbon campaign. Now, when we see a pink ribbon, we don't have to tell what it stands for. Everybody knows, or almost everybody, that it represents breast cancer. So Green Ribbon stands for kidney disease awareness.
We continue this hard work along with our own supportive team, which will be our patients and our staff, our hardworking doctors, medical students, and our undergrad. I'm sure you heard about our Brewing Bean Club.
So we started the Brewing Beans Club in 2015-16 with some of our undergraduates, and now it's the most popular undergraduate clubs on campus. And it's getting so popular that other campuses across the country now are trying to start their own similar clubs.
There's such amazing kids, coming from different backgrounds, different majors, and of course different talents. So when we're coming together with Dr. Rastogi and Christine and our team, not only do we plan or come up with something amazing, but we teach them leadership, anything that they need to know when they're out in the field of medicine.
And the word care is not just medical care, it's that you care about a person. You care about them as a human being. They know that you're there for them. And our eventual goal is to have a core kidney center at UCLA, where all this will be all-inclusive, And this patient advocacy and support group will be a big part of it.
An amazing video there, amazing work by Core Kidney. And I know for all of the people participating in this call right now, can you just imagine, close your eyes and imagine a Core Kidney Center at UCLA where all of this great work is under one roof, one ceiling? It would be quite a thrill to see that. At this time now, it is my great pleasure to introduce a very special guest, UCLA's own Nobel Prize winner in medicine and physiology, Professor Luis Ignarro. He's got a special connection to UCLA Health Core Kidney Program and its founder, Dr. Anjay Rastogi.
Hello there. I want to welcome everyone to this exciting kidney fair. Many thanks go to everyone involved in putting this together and making it work smoothly. It's truly a pleasure to join you for this very important conference on kidney health. You know, it may be difficult to believe, but before he was Dr. Rastogi, he was just Anjay, a graduate student in the Department of Pharmacology at UCLA, working in my basic research laboratory on a very important topic called nitric oxide. When Anjay arrived at UCLA from India in the fall of 1994, I knew right away that he was going to be very successful. He graduated with his doctoral degree in pharmacology under my mentorship, and then went on to train in medicine and nephrology at UCLA. You know, I always knew that he wanted to become a physician, and I'm glad he did. Among Dr. Rastogi's many achievements is, of course, the UCLA Core Kidney Health Program, which has advanced patient care and impacted so many lives. The Core Kidney Health Program is built on a foundation of great science. And let me get serious about science for a moment. I'm a scientist, and I can tell you that science matters. The Core Kidney Health Program is built on a foundation of great science, where science saves lives. I am proud of what Dr. Rastogi has accomplished, and I look forward to even more groundbreaking advances from this program in the future. I want to say thanks, Anjay, for all that you have accomplished since the day you stepped into my laboratory 27 years ago. At this time, it's my pleasure to introduce the visionary behind the Core Kidney Health Program at UCLA, Dr. Anjay Rastogi.
All right. Thank you, Dr. Ignarro, and thank you, Mr. Philip Palmer, for that very warm introduction. I also want to thank Joni Spizzo, UCLA Health, and more importantly, ABC7 for all that they have done to make this event and program possible. So thank you very, very much for all that you have done. Now, it's a true privilege and honor for being here and speaking to you all. We, as Joni's pointed out, we used to do this event at the beach. It was called Kidney Fair at the Beach. But last year, because of the pandemic, we couldn't do it at the beach. And I was about to postpone it. But I got a call from my very dear friend, Mary Beth. And she said to me, we are not going to postpone it. We're going to go virtual. And if you know Mary Beth, we just say, yes, ma'am, when she says something. And you can ask Bill for that, and he would vouch for it. So in 3 weeks, we had to put together this virtual event, and it happened on May 17th during the height of the pandemic. And we had 5,000 attendees from 6 continents. And right away, we saw the silver lining. The reach had just exponentially increased. So one of the questions that I get asked is, are we going to go back to the beach? And the short answer is yes. When it's safe and it's allowed, we will definitely go back to the beach. But the virtual event is here to stay. And what we plan to do is in March, we'll be doing our virtual event. And in the fall, if it's allowed and possible and safe, most importantly, we'll go back to the beach to do a live in-person event at the beach. So that's our future. Now, talking about where we stand on kidney health in 2021. So prior to the pandemic, we had a lot of challenges, a lot of issues, whether it be the burden of kidney disease in general, whether it be the morbidity, mortality, and cost associated with kidney disease, whether it be the waiting list for transplant is ever increasing. The number of patients on home dialysis are not that much. The patients are not aware that they have kidney disease. These were all challenges prior to the pandemic, and we still have them. But now, with the pandemic hitting us, the challenges have increased. But as always, we buckle down, we fight it, and like Dr. Ignaro rightly said, science leads the way. It's all about science, and we are fighting it. We hopefully, will overcome this and make future strides into fighting kidney disease with all these challenges. Now, for some of these unique challenges that we have faced in the past year, you'll be hearing from some of our top experts at UCLA Health. You'll be hearing about COVID-19. You'll be hearing about transplantation. And as Jonice mentioned, some of the things that UCLA has taken leadership in, the equity, inclusion, and diversity, especially as it applies to racial issues, LGBT community, and beyond that. So please stay tuned. We have a very packed program with a lot of very good information. And please put your questions into the chat box and also put them into the Q&A. And we'll try our best to answer as many questions as possible. Now, when you look at kidney disease, the Advancing American Kidney Health Initiative was passed in 2019. And it had three major goals. One was to slow down kidney disease progression, and that is by applying the best practices, clinical research. And I'll go one step further, is to prevent kidney disease from happening in the first place. And that's the first part. Now, for patients who have advanced kidney disease requiring replacement therapy, in those patients, we have to give them the best treatment options, and that's transplant. And if transplant is not possible, home dialysis as a bridge to transplant. So those were the goals number 2 and 3. And of the Advancing American Kidney Health Initiative. So how do we get there? The numbers that were given to us were pretty steep. And a lot of people said it's actually unachievable. I don't believe that. I think it is achievable, but it will take a village. It will take a team. This is all about teamwork. It's people getting together and working together with a common goal of providing the best care to our patients. So we can get there, but we need to have a plan. And what's central to this plan? Central to this plan is what I call comprehensive, integrated, patient-centric care. Now, the term patient-centric is used quite often, but do we truly understand the meaning when we say patient-centric? Patient-centric is patient as a center. Patient is empowered. Patient is empowered so they can become their own advocates and actually participate as a member of the care team. That's what patient-centric is. And the caregivers. When I say patients, I always include the caregivers as well. But for start, it's very important that as healthcare providers of the care team, there's kindness, there's empathy, and there's understanding where the patient is coming from and their caregivers. And this will lead to more trust and faith by the patient in the system, and like I said, in the healthcare providers as well. And that translates into better compliance and adherence. So that I think is quite critical, in my opinion, to advance. Then educating patients, that's quite important as well, that we need to, and providing the right resources. So and by the right resources, meaning that giving the circle of core, which is, and a lot of members are on, it's it's independent of UCLA Health, but it's formed by UCLA patients to provide what we call patient advocacy and patient support group. So please do reach out to us if you have any questions. The extensivist program is also a big part that we provide care to these complex issues. The other part that I wanted to address was the transition to dialysis and transplantation. That's a very critical time. And it's associated with a lot of anxiety, depression even, And the first year on dialysis is associated with increased mortality as well. So we really need to focus on this ESRD care, which has to be under supervised care. And last but not the least is our clinical programs that are dedicated to specific disease states. So I think that's my 60,000 feet view of, we have a lot of things that we are doing at UCLA. I'll be coming back at during the panel discussion to discuss that more as well. And I truly hope you enjoy this program because we have a lot of very good information. And thank you once again for attending this. So Mr. Palmer, right back to you.
Okay, thank you, Dr. Rastogi. And you are a human magnet. People come to you because they love to work with you and help you. And we just can't say thank you enough for everything that you're doing. Now, this has been a difficult year, as you heard from Dr. Rastogi, for everybody. We've coped with the pandemic, particularly it's been difficult for kidney patients and their caregivers. That's why we wanted to bring you the very latest today on COVID-19 efforts. And we're very fortunate to have with us Dr. Daniel Ucla. He's clinical chief of infectious diseases at UCLA Health. He is also co-chief of infection prevention and is a critical lead in UCLA's health response to the pandemic. So now more information for you. Please welcome Dr. Daniel Ucla.
Well, good morning, everybody. Thank you so much. I'm delighted to be here. Thank you to the Core Kidney Program for all the amazing work that you do, and to Dr. Rastogi for the kind invitation. I was asked to speak about where we're going with COVID-19, and I've got about 5 minutes to do it. So I thought I would focus on life after vaccination. So perhaps you have already been vaccinated, or you're maybe considering being vaccinated, or you're ready to be vaccinated, but you're waiting your turn. So what do the days ahead look like for those of us who are getting vaccinated? So fully vaccinated people can do a couple things. First, they can visit with other fully vaccinated people indoors without masks or physical distancing. So that's a major change in the life we've been living over the last year. They can visit with unvaccinated people from a single household who are at low risk for severe COVID-19 without masks or physical distancing again. And then lastly, they can refrain from quarantine and testing following a known exposure as long as they remain asymptomatic. Fully vaccinated people should continue to do a couple things. First is to take precautions like masks and distancing when they're in public. And when they're visiting with unvaccinated people who are at increased risk for severe COVID-19, and we'll go through some examples of these. And when visiting with unvaccinated people from multiple households. Just like we've been doing for the last year, fully vaccinated people should continue to avoid medium and large-sized in-person gatherings indoors, certainly to get tested if they're experiencing COVID-19 symptoms, and continue to follow CDC travel requirements and recommendations. So I've used the term fully vaccinated in the last couple slides. So what does that mean to be fully vaccinated? It means 2 weeks after the second dose in a 2-dose series. So that's if you've received the Pfizer or Moderna vaccines, and 2 weeks after a single dose vaccine from Johnson & Johnson. So what that means is that if it's been less than 2 weeks since your shot, or if you still need to get that second dose, you are not fully vaccinated, and you should keep taking all preventive steps until you are. So this table summarizes what I've just gone through. What can you do if you're vaccinated? Well, you can see on the far right, if you're not vaccinated, you can't do any of the things here. But if you are vaccinated, you can do the first two. You can get together with others who are vaccinated, again, indoors, unmasked, and not physically distanced. You can get together with others from a single household who are unvaccinated and low risk. But you should continue to avoid large gatherings with others from multiple households, again, indoors, unmasked and not physically distant, or visiting public spaces without a mask. So this cartoon just shows what I've gone through. You can see everyone here in this picture has been vaccinated. They've got that Band-Aid with the green check in the top right, and you can see they've kind of got a protected bubble around themselves, so they can visit indoors, unmasked, and without physical distance. In contrast, here you've got a couple people who are vaccinated, but there's multiple households gathered together. So they need to continue to wear masks and maintain their distance, just like in the picture. And you can see in the background that the window's been open for some fresh air, which is always a good idea as well. So let's go through a couple examples. And I've used grandparents in these examples because, of course, those over age 65 have been the first group prioritized for vaccination. So grandparents are fully vaccinated. Can they visit indoors with their healthy, unvaccinated daughter and grandchildren without masks or distancing? And the answer to that is yes. So that's a major change. And I can tell you, I've got parents and grandchildren who they want to visit with. So they're very excited to spend time with them without masks and distancing. Grandparents are fully vaccinated. Can they visit indoors without masks or distancing with their unvaccinated daughter who's undergoing chemotherapy for breast cancer? And the answer to this is no, because now their daughter is higher risk for severe COVID because of her chemotherapy and breast cancer. So we should not be taking any risks in visiting indoors without masks. Let's go through a couple other examples. Grandparents are fully vaccinated. Can they visit indoors without masks or distancing with their 70-year-old unvaccinated friend? And again, the answer is no, because based on the age of 70, that individual is at higher risk for severe COVID-19. However, if the 70-year-old does get vaccinated, then yes, they could all visit indoors without masks or distancing. And then lastly, fully vaccinated grandparents are visiting indoors with their unvaccinated daughter and her children. I've already told you that that's okay. Can the daughter's unvaccinated neighbors also come over? And the answer to this is no, because now you've got multiple unvaccinated households mingling together and you don't want that. So the answer is no. So remember, despite being vaccinated and all the things that allows us to relax, there are still precautions we all need to be taking. So to wrap up, remember to wear masks, maintain 6 feet of distance, avoid large crowds, and continue to wash your hands and be safe. Thank you, everybody, for the time, and I look forward to the panel discussion later.
Dr. Uslan, thank you so much. It is absolutely imperative that we get medical guidance on this and not just talking to each other and coming up with our own conclusions. So thank you for helping us all understand a bit. Now, our next speaker is Dr. Gabriel Danovich. He's professor of medicine and medical director of the UCLA Health Kidney Transplant Program. Dr. Danovich, renowned around the world for his advocacy on behalf of kidney patients, for organ transplantation and human rights. Personally, he is a wonderful friend and human being, and I'd like to please welcome to our panel now, Dr. Gabriel Danovich.
Well, thank you all. It's a delight. Let me get started here.
Dr. Danovich, you got to turn on your camera. We want to see you. There you are.
All right. Good morning, everyone. I can't imagine a better person to introduce me than Philip Palmer. I don't know whether people in the audience realize that Philip Palmer himself is an organ donor. He donated one of his healthy kidneys to a colleague 13 years ago and gave that person another big piece of his life that he could enjoy. There's something magical about organ donors. Organ donors, I think, are a reminder of our shared humanity. And in these times when you put on the news and we see so much hatred and a lack of understanding between people and divisions, organ donation, I think, is something that brings people together. And I tell my colleagues at work sometimes, if you're sick of watching the news and seeing people fighting with each other, just come to the organ donor clinic and see good humanity, decent, normal people who donate kidneys to each other and help each other. It's a beautiful thing. It's a good deed. It's a mitzvah, as they say. And Philip Palmer is a prime example for that and has been a protagonist of organ donation all these years. I think Philip would probably agree that organ donation not only improves the life of the recipient who gets the organ, it also enhances the life of the donor, because the donor gets to live with the knowledge that they have done something radical to improve the lives of somebody else. And there is something wonderful about carrying that in, that self-worth for having donated an organ to somebody else. And I have to say, this also applies to deceased donation. Deceased donation is a scary thing. After all, nobody would want themselves or any loved one to die suddenly in circumstances that permitted deceased donation. But deceased donation can provide solace to families who have been suddenly lost their loved one in the knowledge that that loss was not totally wasted. So I'm going to tell you at this time, everyone, discuss donation with your families, sign your organ donor cards, or sign on to Donate Life California to indicate that you would be prepared to be an organ donor in the event of sudden death. I want to go back to talk about living donation again, and talk about a little bit about the issue of compatibility. A lot of times people may want to donate, but they are constrained because they think they may not be compatible to their potential donor. And I would like to tell you this: the most important thing about being a living organ donor is to be motivated and to be healthy. If you're motivated and healthy, we are able in the transplant programs to make that donation happen through paired kidney exchange, which is a wonderfully exciting new development whereby kidneys are exchanged between couples who are incompatible one to each other, or from what we call desensitization, because the blood groups may be incompatible. We can make that happen. So compatibility shouldn't be the issue. The issue should be, are you motivated? Do you want to do this? And of course, are you in tip-top health? Because a kidney transplant program will never take a kidney from someone who's not in tip-top health, and will be absolutely sure that their health in the long term will be maintained. There are other things we can do too. We can provide what are called vouchers, where you can donate ahead of time to someone who may need a kidney at some later date. So we would come across all new ways of promoting a living donation. Another important development is the fact that now we are able to cover the costs of people who want to be organ donors, the travel costs, the hoteling costs, work lost. This has made it more difficult for people who are in the lower socioeconomic groups to be donors. They love their recipients just as much, but sometimes it's harder for them for financial reasons. And these days we're able to cover most of those things. So I think that's really, really important. And I think that's something that everyone really needs to know. Let me end up by saying a couple of words about COVID. COVID has indeed been a terrible threat to organ donors, to organ transplant recipients who have had a high mortality rate. And I have to say that I strongly encourage everyone, particularly organ transplant recipients and patients who are taking immunosuppressive drugs, to please get vaccinated and get everyone around vaccinated for you. In the new health legislation that Dr. Rastogi just mentioned, we can now pay for immunosuppressive medications, so that takes away some of the stress that patients may have about payment for their drugs over the long term. So I wish everyone here good health. Thank you to the group, to the core group, for promoting organ donation, and discuss that with your family and friends. And if you're healthy and well and consider organ donation, then contact your local transplant program and let's see if we can make that happen. Organ donation, I think, is the greatest antidote to the hatred that we sometimes find among people. And organ donation just brings people together, and let's do whatever we can to promote it. Thank you.
Dr. Danovich, thank you very much, and very kind words. I will say one of the things that you touched on from my perspective, which is so very true, I was given much more than I ever gave. It changed my life remarkably. So for anyone thinking about it, it is a gift to me as much as it was to my recipient. And I want to say thank you to you and all of the doctors who've dedicated a career to saving lives, whereas I gave a moment of my time on this planet to help someone else. But thank you for all that you have done. We're going to talk to you again in our panel. At this time, though, we want to bring in Dr. Keith Norris. He's Executive Vice Chair of the Office of Equity, Diversity, and Inclusion at UCLA Health. Dr. Norris is an internationally recognized clinician, scientist, and health policy leader who's been instrumental in shaping national health policy and clinical practice guidelines for chronic kidney disease. He's made major contributions to health equity, diversity, and inclusion while addressing disparities in contemporary society. So as we continue here this morning, please welcome Dr. Keith Norris.
Thank you very much, Mr. Palmer, and good day, everybody. I want to first give a special thanks to UCLA Health leadership, our amazing sponsors, and Dr. Rastogi for hosting this conference and for giving me the opportunity to speak with you today. Many of you have probably heard about health disparities. Here in the United States, as well as many other countries, we've seen communities of color suffer 2 to 4 times the rate of COVID-19 hospitalizations and death, highlighting racial and ethnic disparities in health outcomes. The reasons for these disparities is longstanding racial and ethnic inequities in the distribution of resources in our society, as well as other factors. In addition to the pandemic, as Dr. Danovich mentioned, this year has been notable for many protests to fight racial and ethnic injustice, including the many recent episodes of anti-Asian racism. Together, these events have made racial and ethnic equity in health headline news. What I want to do today is to review 3 key points. 1, what is racial equity in kidney disease? 2, why is racial equity in kidney disease important? And 3, what is it that UCLA is doing to address equity in kidney disease and kidney health? So first, what is racial equity in kidney disease? As a reminder, kidney disease is common, kidney disease is harmful, and kidney disease is treatable. Kidney disease is most often due to diabetes or high blood pressure, which are known as the major risk factors. Kidney disease and diabetes, and in many cases, high blood pressure occur much more commonly in people from communities of color, including Black, Hispanic, American Indian, Pacific Islander, and Asian communities. Indeed, these racial and ethnic groups are 1.5 to 3 times more likely than their white peers to end up needing dialysis or a kidney transplant. This is called racial and ethnic disparities in kidney disease. So number 2, why is racial equity in kidney disease important for UCLA Health, especially if the main problem is how society makes investments in different communities? Well, at UCLA, we're dedicated to making sure each person from every racial and ethnic group has the same chance of getting good kidney health. We understand that people from communities with fewer resources, such as education, housing, employment, access to quality food, safe places to exercise, access to quality healthcare, and more, are more likely to have kidney disease and kidney disease risk factors. What many people don't understand is why these resources are unevenly distributed across different communities. A lot of people are asking, well, we had the 1964 Civil Rights Bill, didn't that end it? And unfortunately, it did not. In fact, many of you may not know, there was an 1865 Civil Rights Bill. And as you can imagine, it didn't end racial and ethnic injustice either. Passing bills are important, but not enough. In the end, equity is dependent on the hearts and minds of people. No one on this Zoom created these systems, but if we all don't actively change it, health disparities will continue, especially for medical conditions like kidney disease, diabetes, and high blood pressure. So third, what is UCLA doing to address equity in kidney disease and kidney health? Well, UCLA recognizes that where people live can impact their health and is now working very hard to assess and address key resources each patient may need based on the community where they live. At UCLA, we use all this information from health disparities as well as genetic studies as part of our research to better understand kidney disease. But where UCLA can and does have the most impact today is to make sure each patient we see, we are providing the highest quality of care and cutting edge treatment to address their individual kidney disease and kidney health, while remaining aware that their group membership, their culture, and where they live can also affect their kidney disease risks. Most importantly, we're committed to treating each patient with respect and compassion, as Dr. Danovich mentioned. It is equally important that each patient treat the staff and providers with respect as well. And if we can all do that, we're moving much closer to achieving equity in kidney disease and equity in kidney health. So in closing, we're excited that although that although we don't have all the answers at UCLA, we're working hard to make equity in kidney disease and kidney health a reality to ensure all patients have the best possible care and best possible health outcomes. Thank you very much for giving me a few moments today, and I'll now turn it back to Mr. Palmer.
Well, Dr. Norris, thank you very much. And thank you to you and to UCLA for being so proactive in providing access to quality healthcare to everyone. It's so important. Our next speaker is Dr. Amy Weimer. In 2016, she founded the groundbreaking UCLA Gender Health Program. And over the past 5 years, she's trained more than 50 UCLA Health, LGBTQ, and gender health physician champions throughout the organization. The program she founded has gained recognition around the world. It is my pleasure now, and please, I would ask you to also welcome Dr. Amy Weimer.
Thank you so much, Philip, and that's a very kind introduction. I'm very honored to be part of this panel who is clearly providing excellent care across a whole variety of areas within our health system, our country, and our world. I'm really moved as I witness this panel by the sense of community. UCLA's core kidney health program has long been known for its connection with community, and today's event is certainly one example of that. And at UCLA, we really strive to serve outstanding healthcare to all of our various communities across the health system. The LGBTQ population is one community that has historically been underserved by medical systems. And unfortunately, there has been a long history of discrimination within the healthcare realm, which may cause LGBTQ patients to distrust the healthcare system and be less likely to seek care for general health, for specialty care, and for specific concerns that may be related to their LGBTQ identities. So UCLA has developed a number of programs and initiatives to improve the healthcare experience of our LGBTQ patients. The first is that we've created a designation that our providers can earn called the LGBTQ Champion Designation. And they can earn this through education, training, research, advocacy, and expertise in providing LGBTQ-focused healthcare. Our gender health program is a multidisciplinary, comprehensive healthcare program for individuals who are transgender or gender diverse that can provide the entire array of gender affirming treatments as well as general healthcare in a very individualized approach to meet patients where they are. Our CARE program is a cutting-edge program providing clinical care and research opportunities to people living with or at high risk for HIV infection. And our EMPOWER program is a multimodal mental health program providing individual therapy, group therapy, and psychiatry to LGBTQ people of all ages. Information on these various programs is available on our website and will be posted in our chat as well, and you certainly can always reach out to us for any further information. We've also developed policies to improve the care experience. Our non-discrimination policy explicitly lists sexual orientation and gender identity as protected characteristics. And our rooming and visitation and family policies are very inclusive of all definitions of family, all gender identities, and all sexual orientations. We really believe that receiving care for people who have complex medical conditions at a large academic institution such as UCLA can provide for the most excellent care. We're accustomed to caring for people who have complex medical conditions, collaborating across specialties, understanding how different treatments may impact and interact with other aspects of health. For instance, in people living with HIV, we know that you're at increased risk for chronic kidney disease, as well as progression to end-stage renal disease. This may be from direct effects of the HIV virus, and this may be from HIV-associated medical conditions. People living with HIV have been receiving kidney transplants for over 2 decades with good outcomes and improving with time. And in 2013, a landmark act was passed called the HIV Organ Policy Equity Act, or HOPE Act. And this act allows for HIV positive donors to provide organs for people living with HIV who are in need of transplant under research protocols. UCLA is very proud to participate in this project, expanding much needed access to our patients living with HIV who can now receive kidney transplants from deceased donors with HIV. Dr. Joanna Shainman is the principal investigator for this study, and we certainly can provide any further information if you have questions. For our transgender and gender diverse patients, there are some specific considerations for folks who are living with chronic kidney disease or who have had transplantation. The approach to gender affirming hormone therapy may need to be modified for people with chronic kidney disease. There are certain agents that we opt not to use. There is a complex interplay between chronic kidney disease and gender affirming hormone therapy on other medical conditions. For instance, the risk of developing a dangerous blood clot or of having an impact to bone health. And some kidney conditions potentially may be impacted by hormones. So our goal whenever we're seeing a patient who has any complex medical condition is to educate that patient about our options, discuss the risks and benefits specific to that individual, and then decide together how best to help each patient live the healthiest life possible. Thank you very much for including me on this important day, and I'm very moved to be part of it.
Well, thank you, Dr. Weimer. And again, we have our panel discussion. So there's a couple of issues that you brought up that will be great topics for when we get everyone together. But again, thank you for your pioneering work in this area as well. Our next video we have is from Steve Chapman. He's a UCLA alum. He has a degree in microbiology, immunology, and genetics. And Dr. Rastogi and Mr. Chapman actually were UCLA students at the same time. He currently serves as the CEO of Natera and is a big supporter of UCLA Core Kidney Health Program and UCLA.
Hi, I'm Steve Chapman. I'm the Chief Executive Officer of Natera, one of the world's leading genetic diagnostic companies. The mission of our company is to change the way disease is managed worldwide. Prior to joining industry, I spent many years at UCLA and I studied in the Department of Human Genetics. So I'm excited today to announce our partnership with the UCLA Core Kidney Program to bring our expertise in genetics to the field of chronic kidney disease. Genetics plays a critical role in the health of your kidneys. 1 in 10 patients that have chronic kidney disease have a genetic etiology, according to a recent publication in the New England Journal of Medicine. And 89% of those patients that are diagnosed with a genetic disorder would have a change in care as a result. So we think this could have major implications on the way patients are treated in the future, and we're excited to be at the cutting edge of medicine with the Department of Nephrology at UCLA and the Core Kidney Program. I hope you have a great event, and thank you for inviting us.
And thank you for all the work you do. So we've heard from each of our panelists now. We're a little bit over, but we're going to try to make sure that we get a panel discussion going on. So please don't step away, but we're going to bring back all of our doctors now because we have so many things that we'd like to talk about and dive into them a little bit more for about 20 minutes if we can. And again, we have some 600, almost 700 participants right now. I've seen a lot of questions. I've seen a lot of chat notes coming up. We're going to try to get to as many as we can, but we have some things that we want to talk about. So we're going to get all our panelists to turn on their cameras so that we know that they're there. But Dr. Rastogi, I'm going to start with you because we just heard from Mr. Chapman and the genetics in kidney disease program. That's fascinating as we look forward. And when we look back in transplants and the anti-rejection medicines that are out there, it's fascinating the developments we've had. You have paired kidney exchange. But when we talk about the genetics in kidney disease program, is that our moon mission or is that our Mars trip? What's next for that?
First of all, Mr. Palmer, I think you're always right on. It's the question that you ask. I do want to thank Mr. Chapman to actually support us, participate, and speak on such a short notice, actually. But what he said was quite mouthful, and so did you, Mr. Palmer. So if you look at the future, the way I look at it for medicine, genetics is going to be at the front and center. You know, whether it be genetic testing or modulation of the gene expression, whether it be through gene therapy or other medications that can actually modulate gene expression. Mr. Chapman mentioned, the percent of patients that we think have genetic causes or monogenic causes of kidney disease. I think it's a lot more than that. What we have to be careful about is when we see a patient who's listed as kidney disease, cause of kidney disease not known, number one, or hypertension, which is obviously something that we have to take not with a grain of salt, but with a load of salt. Because a lot of times kidney disease causes hypertension and we find it so late that we list that as the cause. So the reason I'm saying all this is that if we don't know the cause especially, we need to find the cause, and a genetic diagnosis might help us. And might not just help us, the patient, but their family and generations to come. And also, as you mentioned, in transplant as well, most of the living donors are still living related. And we want to make sure that they are safe as well. So I look forward to working with the genetics program. Dr. Bianca Russell is our partner, and she has been a great asset to us ever she joined from University of Cincinnati. And it's going to be a great program, Philip. You'll be hearing a lot more about that.
Well, I'd like to ask Dr. Norris something here, if Dr. Norris had his camera on, because when we talk about genetics, and it brings to mind nature versus nurture, and you start talking about kidney disease, race and ethnicity and background, treatment, medication, how would that help? When you start talking about genetics, how would that help make sure that equity in treatment is assured?
Right, great question. So by and large, although we talk a lot about race and ethnicity and we want to know these factors, by and large, there are more differences within groups of people than between groups of people. So we sometimes see some differences in some study results, but when it comes down to an individual patient, usually the best medicine that we have available is the best medicine for whoever you are, regardless of your gender identity, your race, ethnicity, your sex. It's just the best medication. And then we do spend some extra effort sometimes to think about, might there be other factors because of what's happened in society that might impact your ability to adhere to a treatment plan. But by and large, it's rare that there's any difference in medication or treatment based on race, ethnicity.
Well, yeah, you think of it, we're all the same on the inside.
We're talking about, because it really is one, it's the human race. We just have one race. The other stuff we just made up.
Right, and we're talking about kidney health. I mean, kidney pretty much look the same everywhere you go. And Dr. I wanted to come back to some of the things that you were speaking of. We're talking about equity, and we're talking about diversity of treatment, making sure everybody gets the same treatment. But you mentioned being a donor as an HIV person, and then also, how does sexual orientation factor in? And when I say that, I mean from the personal perception. How does someone see what's being treated as a human being? How does that play in some of the work that you
so to answer the latter question first, I think we really view all sexual orientations and gender identities as what we call normative. We know that sexual orientation and gender is a spectrum, and people's experience really lies across it. And so from the standpoint of general health, it's not a particularly relevant issue. For folks who are living with HIV, it's actually very exciting that now they can register as donors, as potential organ donors, whereas previously that was an exclusion from being able to donate organs. And those organs would then be used to transplant into other individuals living with HIV. And that donation, that registration to be an organ donor is the same as for any other individual. And I believe that's been posted a number of times in the chat. So the great news there is that we really see HIV now as just a chronic medical condition that we have excellent tools to manage. Many patients with HIV are living very healthy lives, which make them, great potential recipients and great potential donors, as long as we're donating into somebody else who has HIV. So I think that the science is very good. The outcomes are very good in the transplants that have happened, and very exciting that those are occurring at UCLA.
If I could very quickly, I'd kind of clarify one of the question I asked. I almost was asking the perception of a member of the LGBTQ community. How do they feel they're being treated? I mean, do they have those elements changed? Because as we were talking about with Dr. Norris, we're all same on the inside.
Mhm.
But for the LGBTQ community, are they more open to become donors? Is their perception of self changing?
I think it's very individual, first of all. I think that many LGBTQ people still face a lot of discrimination and have reluctance in coming into healthcare settings. We often hear patients come to us saying it's really a relief to be in a place where they feel like they can be embraced as themselves. But I think the opportunity to be able to serve as a potential donor, you know, as Dr. Danovich was making mention of, is really a wonderful gift to be able to give, a very validating experience. And we really look for all of these different tools we can to help people live their fullest lives, inclusive of, not despite, but inclusive of their sexual orientations and gender identities.
Well, since you brought up Dr. Danovich, I want to pivot just a little bit because you briefly mentioned the COVID vaccine. You are a proponent of all of the vaccines, whether it's Johnson & Johnson, Moderna, Pfizer, or I would guess whatever is to come, because it will be vetted by the scientists around the world to make sure that it's safe. My question is kind of personal, but then I kind of would like you to expand upon it. With one kidney, going and get the vaccine. Tell me, how does that play for the living donors out there, for people who might have had kidney disease, they lost a kidney? How does that play?
Oh, I would say, Philip, just get vaccinated. And whether you have one kidney or two kidneys, it doesn't make any difference. And even if you have chronic kidney disease and advanced kidney disease, get vaccinated. If you're on dialysis, get vaccinated. If you have a transplant, get vaccinated. I see there are a number of questions on and don't worry about which vaccine and the percentages that you hear about. They're all very, very effective, and they stop people from dying, and they stop people from ending up in ICUs, which is really, really what we're all concerned about. So get vaccinated. There have been several, I can see on the chat, talk about concern about antibody development. I would say really, really, please don't pay too much attention to the antibody issue. There are a lot of different antibodies involved. It's hard to know whether they're protective or not. Just get vaccinated. We have every reason to believe that vaccines are very, very effective in transplant patients, in non-transplant patients, in patients with one kidney, with two kidneys. Get vaccinated.
Well, and correct me if I'm wrong, getting COVID is much more risky if you only have one, rather than the vaccine would be to you, correct?
COVID is very dangerous to transplant patients, very dangerous indeed. So any concerns people have about the vaccine should be overcome by concern about getting COVID. There's a high mortality in transplant recipients from COVID, 10 to 20%. It's really horrific. So get vaccinated, because any risk associated with the vaccine, and they're extremely small, are greatly overcome by the risk of getting the actual disease. So I can't emphasize to people, get vaccinated. Don't worry about the antibody response. There's a lot to be learned about that. Just get vaccinated.
Dr. Ucla, if I could ask a couple of questions about kidney disease and COVID, one of which, you know, it's impossible to know what long-term effects of COVID are right now, because COVID has not been around long enough really for us to gauge that. But we do know, as I understand it, that there are a high number of cases of kidney disease caused by COVID. Looking forward, what do you see as need for transplants when it comes to people who've had COVID now and they have damage to their kidneys going forward? I mean, is that something that we're going to have to deal with?
Yeah, it's a really great question. Let me give a little background as a means of an answer. So we know that some people suffering with severe cases of COVID-19 definitely show signs of kidney damage, even those who had no underlying kidney problems before they were infected with the virus. Up to 30% of patients hospitalized with COVID-19 develop moderate or severe kidney injury as a result of their hospitalization and the virus. Sometimes the kidney damage is severe enough to require dialysis. Many of those patients with severe COVID-19 had risk factors that are also risk factors for kidney damage, including things like high blood pressure and diabetes. It's uncertain at this time how many people with COVID-related kidney damage regain their kidney function. And yes, some of them may go on to need dialysis long-term or have chronic long-term consequences from the COVID-19. We have seen patients at UCLA who recover their kidney function despite being very sick. How often that occurs is still not known, but without question, if someone does develop dialysis while they're hospitalized, that is a worrisome development. So there's a lot of research being done on this, and it'll be something that we have to see. But in the meantime, as Dr. Danovich mentioned, we should all be encouraging vaccination as much as possible, especially in our patients with chronic kidney disease and transplant patients.
Now, we have talked about a lot of different elements throughout the day, and each of you has a very special level of expertise. Now, the question I want to ask all of you, and I'm going to start with Dr. Rastogi, because what Core Kidney does at its core is try to bring all of these things under an umbrella. And where whatever my issue might be with kidney disease, I'm finding it all in one place. But how important would a kidney center at UCLA be, where Dr. Weimer, Dr. Norris, everybody, Dr. Ucla, Dr. Danovich, you can all go to one place and share ideas and share treatment and make sure that everybody is getting the best treatment. Dr. Rastogi, how important would it be to have a kidney center?
So Mr. Palmer, I would like to say, first of all, thank you for all the questions that you're putting together because they're all relevant. I would say it's of utmost importance that we get a kidney center. Just like we have the Connie Frank Center for Kidney Transplant, that all this care is under one umbrella, whether it be clinicians, dietitians, social workers, all the panelists that are on this, they can all work together. And that also, breeds ideas, research, nobody left behind. Focusing on other aspects besides direct medical care. We spoke about mindfulness, diet and nutrition, pet therapy, serving the underserved population. So, but that needs some financial investment. And that's what's really stopping us. But we need that. And we are hoping that we will have that soon. But that's a big need, Mr. Palmer.
Well, Dr. Norris, I mean, when he mentions some of the topics there, when I think of gathering together under one roof with a kidney center, right. You walk in, you see people who look like you see people dressed like you see people who are facing the same challenges at you. It goes across the socioeconomic ladder. Wouldn't that be something where everyone begins to feel comfortable and confident they're getting equal treatment?
Absolutely. And as you said, they'll feel comfortable, confident, and I think that also has a big impact on their level of trust around being part of the health environment. And for the faculty and the staff and the rest of the team, as Dr. Rastogi mentioned, it's just very inspirational to be able to share ideas, to be able to share different views, and then to interact with patients at the same time who may really say something insightful that frequently, some of the best ideas, quote unquote, I've had, I didn't have. My patient partners had, right? My job was to then do something with it. But that's what happens when we have that type of environment.
Well, Dr. Weimer, to bring you into this as well, one of the things I think of as a donor or as a patient, so to speak, when a patient is in an area where everyone is coming and going, aren't you more willing to ask a question of a person sitting next to you that may have gone, because you guys are doctors and doctors have a perspective. But as a patient, I've gone through things that other patients have gone through. And in an environment like the Kidney Center, can't I get information from my fellow patients?
I think that's a wonderful point. And, we know that having peer support or peer mentorship from individuals who have been through the process before is an incredibly important part of navigating any difficult medical situation. And I think that just watching the chat and the Q&A box during this talk is a great example. So many questions and pieces of advice going back and forth between patients and between previous donors and people who are considering donating, and being able to have those structured interactions within the kidney center would be invaluable.
Well, Dr. Danovich, switching topics just a little bit, you said to me, and it was a year ago, and I have quoted you any number of times, and it was regarding COVID and our reaction to COVID. You said, be cautious, don't panic. You can apply that thought process to almost everything we're talking about here today, from kidney disease to the vaccine to COVID. And I think that's just a genius comment that should really spread as much as we can. Be cautious, don't panic.
Well, thank you. I'm glad you got such a good memory, Philip. Yeah, I repeat that. I tell patients all the time, be careful, but don't be fearful. Be careful, but don't be fearful. We have to go about our lives. Life is never risk-free. I tell people you have to cross the road. Crossing the road is dangerous intrinsically, but we have to cross the road. So all of us have to move ahead with our lives. Just be careful, look right, look left, be careful, go about our lives and enjoy it. And the one thing I do want to say, in medicine, and not just in medicine, we so frequently tell people what they shouldn't be doing. What I want to tell people is what they should be doing. They should be enjoying life. They should be exercising. They should be going outside when they can. They should be eating when it's safe to eat, enjoying food. Food is not the enemy. Food can be your friend. You can enjoy it. So we're so frequently telling people things they shouldn't do. I like to tell people what they should do and to enjoy life, even though they may have restrictions that are intrinsic with their disease process.
Well, Dr. Uslan, I'd like to get at least one more comment from you because we are starting to run out of time. But when we talk about COVID and kidney disease, does having chronic kidney disease increase the risk of getting COVID in the first place?
Yeah, it does, Mr. Palmer. Having chronic kidney disease of any stage really, it does increase your risk for severe illness from COVID-19. There are a couple of reasons. People on dialysis can have weaker immune systems, making it harder to fight infections. However, it's important to know that kidney patients need to continue with their regularly scheduled dialysis treatments and to take any necessary precautions as recommended by their healthcare team. I'll echo what Dr. Danovich says, to live your life, but not live it in fear. Also, that patients with kidney transplants need to take anti-rejection medications, also known as immunosuppressive medicines that make their immune systems a little bit less active, which can make it harder to fight infections. So what should kidney patients be doing about all this? So a couple things. One is to continue their medicines and their diet as directed by their healthcare team. Stay in contact with their healthcare team as often as possible, especially if they have any new signs or symptoms of illness, and certainly reach out to them if they can't get the medicines or food that they need. If they're on dialysis, to stay in touch with their dialysis clinic and their healthcare doctor if they have any signs of sickness or have any concerns. And then lastly, I'll make a plug that the National Kidney Foundation has put together some great resources for COVID-19. I'll paste the link to that in the chat. So if people have further questions, they can do some reading from NKF.
And thank you very much for that, Dr. Uslan. And there is a lot of information in the chat and the Q&A. A lot of people who've been through kidney disease or been a donor have tried and offered help in the chat, and we're trying to get all of those answers as well. We have run out of time for our panel discussion, but Dr. Rastogi, I didn't want to wrap this up without letting you offer some final thoughts.
Oh, thank you, Mr. Palmer. And I do have some thoughts. And I know we're a bit over, but I think it's important to share those. First of all, I want to thank some key people, obviously all the people who participated in this, but some people who are behind the scenes and they have contributed immensely. Without their contribution, this event would not have been possible. Number one is Nikki Bonner and Robbie Gluckson. So thank you very, very much, both of you, for working incredibly hard for the last 3 months to putting this event together. There were a lot of minutiae and details that went into this. I want to thank Anita and our core kidney program and the Bruin Bean Health for participating in this. They're all live and monitoring the chat box. Nick, Jackson, Curtis Austin, Scott, and Dr. Pfeffer, Linda Ho, for all their support, and ABC7, Philip. I mean, they have been so supportive of these events every single time. You know, please give my best to Giovanna, Lara. I think the way she spoke core kidney, I loved it. I mean, that's the way to say it. I mean, only person who could say better is you. But let me talk about Philip Palmer at the end, and I don't want you to blush or stuff. But what do you mean, Philip Palmer, to all of us? What do you mean to me as a kidney provider? You have walked the talk. You have given your kidney, but you've gone way beyond that, Philip, and you've been a true advocate for kidney disease awareness. I don't think you know, this world is a better place because of people like you. And, you know, I just want to thank Maureen for letting us share you during a Sunday when you probably spend time with your family. You said something that I think I hear from a lot of living kidney donors, Philip, is that it appears you gained more than probably even the recipient in some ways. And that's a recurring, you know, we have so many kidney donors right now on the call. That's something. So that's incredible. I mean, that's really, really incredible, Philip. And like I said, this was not in the script. This is not something that I want. And I know you don't like to hear this, but thank you, Philip, from the bottom of our heart. Thank you for all that you have done. And with that, I mean, I think I just want to thank all the attendees. I think we have gotten a lot of, we want to thank all our supporters. You talk about Kidney Center, we need more support like that. We have a lot of big supporters. We need them, all our sponsors, and everybody who has attended. Thank you very, very much, and God bless.
And Dr. Rastogi, thank you. It's very kind. The problem with the Zoom call is I can't hide. I have to sit here. But you know, the funny thing is I saw many living donors in the chat, and they were all volunteering to answer any question that anybody might have. And I think if I could speak on behalf of them, we're all willing to answer the questions. And I hope if you need to find me to answer a question, I am more than happy, because there are so many answerable questions as a living donor that I am more than happy to answer. And so too, so many people that I saw in this that they are willing to share that information. So feel free to ask and to take opportunity of the people in the chat, because it is a very doable thing. Being a living donor, and as a deceased donor, it is just the ultimate gift. You can help so many people, and the work that you doctors do for your career and your life is so much appreciated by me and so many other people. But as we close out our conference today, we want to go back to the people who are the reason for the UCLA Health Core Kidney Program, and that's the patients.
And Philip, Philip, sorry to interrupt, but I missed one key person.
Okay.
Christina Lopez. She is the person behind this event. I truly didn't want to interrupt, but Christina, thank you so much for all that you have done. This event, or any event, would not be possible without you. Thank you.
If that interruption is the only hiccup that we have today, thanking Christina with, you know, nearly 700-800 people on this conference Zoom call, I think we're going to be okay. But having said thank you to Christina, let's go to the patients again. They're the driving force behind the science, the research, the clinical care and support that UCLA Health delivers every single day.
We need more programs like Dr. Rastogi is offering, where you can reach out to people and actually talk to somebody, or just raise the awareness to a level that people are more aware of this. Not that other diseases are not important. They all are important, but you know, the more we can look at the amount of people in the United States who have kidney failure, it's a very large group.
I worked in the CV ICU for 10 years, and I worked with heart transplant patients for all of that time, and I became very emotionally connected and close to these patients. And I saw a lot of them make it to transplant. Some never survived a transplant, and then some were on our unit for 3, 4, 5 months on various types of mechanical support. And I always wished I could do more for them, rather, other than just being there. I always wished I could donate my heart, but of course that was never an option.
Now being tested positive for Alport syndrome, I initially am very worried about my future, but it's really important that I'm being proactive and making sure that I stay healthy. Looking at my dad, how active of a person he was. He ran a marathon before his diagnosis. He always played soccer, even when he was diagnosed. He was still very active. He ate very well. So just seeing obviously how successful that was in his recovery to getting, his kidney transplant, that is very motivating for me. And even though now I don't have any symptoms of having Alport's, even though I know that I do have it, I just need to make sure that moving forward, that I'm taking care of myself and that I'm really making sure that I'm constantly getting checked, going to those hearing checkups, going to see Dr. Rastogi once a year, just to, always just make sure I'm stable and that, I'm being proactive.
Hey guys, listen. I was a former amateur boxer fighting for my life in the ring. Now I have to fight my life outside of the ring. This is what 6 months post-kidney transplant looks like. And now that I'm a post-kidney transplant patient, I did a 50.5-mile bike ride and a 10K run that I'm really, really excited to share with you guys. My name is Mark Coronel, a kidney transplant recipient, here for the Core Kidney Program. Remember, never give up. Life is a fight, and make sure to always keep your hands up and keep moving.
I can't wait till we get back together to see Mark again. He is an active participant and just a wonderful human being. His energy is infectious. Even before his transplant, that was one positive man when we got to meet him down at the beach. I'll never forget it. One thing I'd like to add personally as we wrap this up, when we talk about kidney disease, and we heard from those patients just now, so many people have been staying home over the past year, not seeing their doctors, not going in person because of COVID. And it was a very real concern. Get your regular checkups. So much of kidney disease can sneak up on us because it's such a silent disease and you might not know you have it for the longest time. So keep getting checked up. Even if you don't think you have kidney disease, go back and see your doctors and make sure you avoid it or you catch it early. But thank you to all of our doctors and all of our speakers and all of the technical crews to make this conference happen. Thank you for being here. We have recorded the program. It's going to be available for you to watch. You can view it on the Core Kidney Conference event page. The link is going to be put right in the chat right now. It's there. I can actually see it. And if you miss it, you simply Google UCLA Health Core Kidney Conference, should come right up. And also, please take time to fill out the short survey you're going to receive when you log out. We appreciate your feedback. We'd love to know what we did well, what we can improve on. It's been amazing to connect with you all. It's an incredible community. You are blessed to be part of this group of people. So on behalf of Dr. Rastogi, our speakers, and everyone at UCLA Health, I wish you the very best good health for the coming year. We look forward to seeing you in future events. So have a great day and a wonderful rest of your weekend, and we'll see you all later.